A very good morning, class. I'm Dr. Sayarchana, reader, oral medicine and radiology department. Today, we are going to see a PowerPoint presentation on bacterial infections affecting oral cavity. So, what are we going to see? The various bacterial infections affecting the oral cavity, how it's going to present, that is the manifestations, and what will be the treatment that we. Okay. So before we get into the depth of the lesson, we will first know what is the difference between bacteria and a virus. Bacteria is an organism which is self-reproducing, that is without a host, whereas viruses are not self-reproducing as they need a host cell. They always need a piggyback riding, so they need a host cell. Bacteria is self-sustaining sometimes, are able to grow, feed and excrete. They have organelles such as cytoplasm, cell wall and a nucleus which performs specific functions set by the cell. Whereas viruses lack any metabolic functions, so they do not grow, feed or excrete. They only have a genetic material and a protective coating, and there is no cell wall. So antibacterials have no effect on virus. Guess you now know the answer. Okay. Bacteria are very much larger than virus. They are more complex DNA and they multiply slower than viruses. Whereas viruses are smaller than bacteria, almost 100 times. They have a simpler DNA and they multiply in a much faster rate than bacteria. Hence the resistance. So you guys understood the basics, right? So virus is always faster and deadly compared to bacteria, but bacteria can be managed if you are identifying it in the early stage because of these reasons. Okay. So the most of the oral infections come in through the odontogenic origin, right? And it has various treatments like endodontic therapy, extraction, or IND, and followed by a therapeutic management. Here we are going to see more such lesions and also the systemic illness which will have dental manifestations. Okay. So every time you have to ask yourself, why tooth? It's because it is a hard, non-shedding surface for the deposition of oral microorganisms which remain within the dental plaque. The accumulation and metabolism of this bacteria occurs on the hard oral surfaces is the primary cause for dental caries, gingivitis, periodontitis, peri-implant infection and stomatitis. So, given the background, I think you've understood a bit about bacterial infections. Now we'll see what are the various bacterial infections that affect the body as well as the oral cavity. Now here today we're going to discuss about scarlet fever, syphilis, actinomycosis, impetigo, tuberculosis and diphtheria. So scarlet fever. Whenever I say scarlet fever, you can imagine a red color because all the manifestations are going to be red. I think you guys would have also seen scarlet fever as a mocktail drink too. That will be mostly red, right? So that will be easy for you to remember. Okay. So this scarlet fever is a systemic infection which is caused by alpha and beta hemolytic streptococci. Since these organisms elaborate an erythrogenic toxin, it enters the body through the pharynx and affects the body. The incubation period of this disease is mostly 3 to 5 days. That means once you've got the infection, it takes 3 to 5 days for it to manifest a disease. And your symptoms will be mostly pharyngitis, tonsillitis, headache, chills, and fever, which may range to 102 to 104 degrees, and vomiting. Now, in short, if you can remember this picture, you will be really not forgetting things when it comes to exam. See how it affects your throat. Literally, I told you it's an erythrogenic toxin, right? So everything becomes red. Look at the bulbous enlargement of the pharynx, okay? So you have pharyngitis, severe pharyngitis. Then the toxin gets released into the blood, and then it causes rashes, okay? Where does the rashes present itself is? In the groin, in the axilla, and in the trunk and the extremities. It is also seen in the skin folds, okay? And then it desquamates. But to check whether this disease is almost correlating with hand, foot, and mouth, you can see the palms and soles, it will be spared, okay? And these are called as the sandpaper quality rashes, okay? So that is why I put the sandpaper picture besides the erythema. It blanches with pressure, and there are mild papular. So all these rashes, will there be tenderness in the lymph nodes? Definitely. So there'll be an enlargement and tenderness of the cervical lymph nodes. Then the characteristic and diffuse bright scarlet skin rashes appears on the third day, which will appear as sunburn. So you guys know how a sunburn is, right? So it will appear like a sunburn. So when there is a sunburn and there is a fever, then you have nausea, vomiting, and malaise, then you can always suspect a scarlet fever. And I specifically told about the skin folds, right? Rashes in the skin fold. These are called Bacterial lines. Okay. But when you diagnose this early and when you give an antibiotic for it, it clears in mostly 8 weeks. Okay, so far so good. We have seen the systemic manifestations. Now, what about the oral manifestation? As I said, it's an atherogenic origin toxin. This will appear as a soft and a scattered petecake. Okay, soft. Okay, so soft is not actually the quality. You can remember this way because it occurs in the soft palate. Okay, the first 2 days there'll be a coating on the tongue. Okay, you can see that like a strawberry. So the first 2 days you can ask the patient to put out. If the patient presents himself or herself to you, there'll be a strawberry tongue. By the fourth or the fifth day, there'll be still more atrophy, and the tongue will appear as red strawberry or raspberry like tongue. Okay, then if you can see the axilla or the skin folds, there'll be presence of pastel lines, and there'll be a lot of sandpaper rashes. So all these things put together, you can identify scarlet clinically. Now, do we only take clinical examination as the mandate for giving an antibiotic or any treatment? No, we don't. We always combine it with clinical examination. So, we have to perform a test called dig test. In this test, you will be injecting the patient with zero point 0.1 cubic centimeter of scarlet fever toxin into the skin. We don't want to put more than that because that itself may cause a disease to occur. So you can stick on only to zero point 0.1 cubic centimeter and leave it for 24 to 48 hours. If there is any reddening of the skin in an area over 10 millimeter in diameter within 24 hours, indicates the presence of disease. Okay, this presence of disease is nothing but a lack of immunity. So hence we are proving it as a positive result. Okay, so after knowing this positive test and correlating with the clinical signs, we are going to give the patient treatment. The treatment is nothing else but penicillin. Okay, it is the antibiotic choice which is proven safe, efficacy, and narrow spectrum. If you're not going for penicillin in cases of allergy, you can go for a broad spectrum. Clindamycin will be a viable treatment. Okay. Now, the next disease that we're going to discuss is about syphilis. You guys already know about this, but still a small recap. Syphilis is nothing but a sexually transmitted disease caused by Spirochete trypanosoma pallidum. It's acquired through sexual contact with the partner, and the active lesions are presented by also transfusion of blood and transplants until inoculation of fetus by infected mother. That is nothing but vertical transmission from the mother. Now, here is a flow chart explaining how the infection affects and the stages of disease that go with it. Okay. At the same time, onto the right side, it will literally depict what happens and how it is going to affect the body. Okay. Now, the infection occurs with Treponema pallidum. It causes primary syphilis. So, the infection of primary syphilis causes chancre at the site of infection, and there will be regional lymphadenopathy. If this disease is not treated at this stage, it will go to secondary syphilis, where you will be able to see disseminated rash, that is widespread rash, and generalized lymphadenopathy. See, it has gone from regional to generalized. And then it reaches the latent syphilis, where 72% sometimes causes no further complications, whereas 28% will go for tertiary syphilis. In this stage, latent stage, there will be a recurrence of secondary syphilis, which lead to 25% of individuals having a symptom. Or if in the case of tertiary syphilis, there will be a gamma, there will be a cardiovascular syphilis. That means you'll have problems in your CVS system and late neurological complications. You don't have sensations, so there will be something called neurological deficit which may occur due to this disease. So how bad is it, right? So these are the pictures which exactly depicts what we just explained. Okay. Yes, as I said before, it is also caused by vertical transmission. That is, the mother getting affected through a partner, and during birth, the child gets it. So this is called congenital syphilis. This, can you see the picture of a child? Look at its oral cavity, the hand, as well as desquamation, the tooth. Okay, so these four symptoms gives you a confirmed diagnosis of syphilis. Of course, these are all just clinical. Okay, in early stages, there will be skin lesions, there will be lymphadenopathy, there may be jaundice and anemia. Whereas in late stages, there may be a gummatous ulcer, bony prominence of a forehead, and a Hutchinson's triad. What is a Hutchinson's triad? This is the typical Hutchinson's triad. Okay, that is including the Hutchinson's incisors, eighth nerve deafness, and in eyes you have interstitial keratitis. That means thickening. So maybe you'll have vision problems. Okay, so don't forget this. Hutchinson's triad. This is a Viva question. So again, how will you diagnose? Both clinically and serologically. The treponemal tests are fluorescent antibodies against T. pallidum and should always be followed to confirm a RPR and a V test. Okay, so don't forget that. And for the treatment, you give the same. You give a penicillin, you give an erythromycin or a tetracycline in case of. The third disease what we are going to discuss is about tuberculosis. This tuberculosis is a very, very dangerous disease. Okay, it affects almost one third of world's population, and it kills me 3 million people per year if it is not treated in the right time. And it's caused by aerobic non-spore forming bacillus called Mycobacterium tuberculosis, and it's spread through air. So you have to be very careful of this. The clinical features, if it's affecting you, you will experience a low grade signs plus symptoms of fever. You will have night sweats, malaise, and weight loss. So the patient will be very skinny, and hence his immunity will be very much down. So typically on hearing night sweats, you should be alarmed. Okay. Whereas, and also you will be having symptoms like cough, there will be blood in your sputum, and there will be chest pain if there is a pleural environment. So now, what will be the oral manifestations? There will be ulcers both in the tongue and there will be a non-healing ulcer that sometimes may be painful. There is bony involvement. Since this infection travels in, there may be a bony involvement in the maxilla and the mandible, which may cause osteomyelitis, inflammation of the bone and the bone marrow. So, whenever you see this disease or when you're having any doubts about a patient suffering from this disease, it's better that you first clinically assess them, then subject them to the clinical test and treat them. Okay. Usual test would be a sputum test to confirm the presence of the bacilli, or we'll do a gene test to confirm the presence of this organism. There's something called gene expert which will say the same. So after confirmation of the presence of this organism in the oral cavity or in the systemic involvement, you have to give a treatment. The BCG vaccine is effective in controlling childhood TB. If not, if it affects you in the teenage time or in the adult life, you can go with these tablets. That is, the first line of drugs is isoniazid, rifampicin, pyranzamide, and these drugs are used in combinations and given till 6th, 9th, and the 12th month. Depending on the species and depending on the severity affected, the treatment regimens can extend up to 2 years. So, you have to be very careful not letting your immunity go down. And if you're found to be positive with TB, find the pulmonologist as early as possible and get yourself treated. Okay. Now this is a small child. This infection is called impetigo. So what is this impetigo and what causes it is? This is a bacterial infection and is caused by a Streptococcus pyogenes and a Streptococcus aureus. Look at the child's picture. It's full of red pustules which have briefly broken down, and there's some macules too. Okay, so it's a childhood affecting diseases. It usually occurs in 2 to 5 years age. Okay, these are non-bullous. That means they don't open and burst, they just occur. Okay, in the adults there are papules and macules which are fragile vesicles, and they are described as cornflakes glued to the, as I said before, the non-bullous form occurs in adults, whereas the bullous form occurs in the children. They appear as a vesicle, they rupture and they form an ulcer. Then and finally it turns into an yellowish crust. So this is how they clinically manifest in the child. A physical examination is mostly enough for identifying. A topical treatment is mostly prescribed here, and topical mupirocin 2% 3 times daily, twice or 3 times daily, can be given for a week, or a fusidic acid is also effective 3 times daily for 8 days. Cephalexin 250 mg can be given for 1 week course, BT only. Okay, so these three can be used as decided by the clinical course. Okay, so this question again is a very important question which occurs most commonly in exams. So listen to this. Okay, actinomycosis. This is a bacterial infection. Most often you get it wrong. So kindly remember it is a bacterial infection and it's caused by actinomyces israeli. How the infection appears when it affects the person clinically is there'll be wooden areas which are indurated. Okay, that means there will be hard when you palpate, indicating fibrosis. Okay, there will also be a suppurative reaction of the infection and cause an yellowish flecks representing bacterial colonies. That means the area will be hard to touch and there will be suppuration. That means a pus discharge may be occurring in the area of infection and it will be appearing yellow. Okay, and when those yellow discharge can, if identified in the microscope, it will be showing you numerous bacterial colonies. So how this infection would have gone into the body is through a trauma or a periodontal infection or a non-vital teeth or extraction sites, which have, so you have to handle this with care, right? So look at the bacterial colonies that are seen when you see this pus discharge through a microscope. Very severe, right? So how will you diagnose this? You can both with the clinical presentations as well as the culture of the tissue or fluid. It should show actinomycosis species. An examination will reveal sulfur granules. So these things are important for the diagnosis of this disease. A TT would be a, so again, what is the treatment? Same. Penicillin or amoxicillin can be given 500 milligrams 3 times daily, depending on the severity of the disease and depending on the age of the patient. Always the body weight must be taken into consideration before you give a drug to any patient for the choice. Okay, and if the patient is allergic to penicillin, you can always give a broad spectrum clindamycin, erythromycin, tetracyclines. They can all be administered. Okay, before prescribing any medicine, make sure that he or she is not allergic to any drug. Then consider the age of the patient, the weight of the patient, and his background, clinical background, before you prescribe any drug for the matter. Let it be a topical drug or a systemic. Okay, so with this, we'll go to the last chapter, last disease. Okay, diphtheria. This diphtheria is caused by Corynebacterium diphtheriae. This diphtheria you can remember like a bull neck. Okay, there will be always a bull neck. Everything will be enlarged. Okay, so it is caused by Corynebacterium diphtheriae. And again, the features will be malaise, sore throat, obstruction of larynx, paralysis of limbs, nasal ulcers, bull neck. Okay, for two things you have to remember bull neck. One is the Cushing syndrome and one is the diphtheria. Look how enlarged the tonsils will be. So, do you think it will be easy for the patient to breathe? Definitely not. And that is why the patient will struggle to breathe. The struggling will cause the muscles to increase in size, hence the bull neck. Okay, so again, how will you diagnose this disease? Clinical parameters check, and then the, of course, the Schick test. Okay, through the same thing as I said before, you have to apply a small amount, that is 0.1 ml of diluted diphtherial toxin is injected intradermally in one arm of the person and heat activated toxin on the other as a control. Okay, in Dick test we didn't do that, but in Schick test, which is confirmation for diphtheria, we have to do in both the hands. Okay, if the patient does not have enough antibodies, you will have a reaction. Okay, so that erythema is telling us that there is a, in this we have to only give a treatment of macrolide antibiotics, that is 5-day course of azithromycin 500 milligram for 2 weeks or 7-day course of clarithromycin 2 milligram per day for 2 weeks. Okay, then there will be a complete resolution of this infection. But make sure that this patient is under constant purview of a pulmonologist, otherwise the breathing difficulty sometimes can cause deadly consequences. I've literally gone through all the bacterial infections affecting oral cavity. The following 3 slides are summary of all the infections that is affecting your oral cavity. So these 3 slides will have a quick recap for you before you write an exam. So these last 3 can be used for revision of your entire bacterial infections. Okay, so that is why the disease is given, how the clinical presentation is given, what will be the etiology and the treatment in a nutshell. You will have the age, the teeth that is affected, and the symptoms that may appear for various bacterial infections which affect the oral cavity. Here, extra information is given about cellulitis too. Okay, and dental caries, gingivitis, necrotizing ulcerative gingivitis, periodontitis, pericoronitis, acute and chronic infections, and these are the pathogens which affect the oral cavity. Okay, these are the bacterial pathogens. So this slide can be used as a recap and for your viva preparations. So you can have a look before you present yourselves to your viva. These are my references. Thank you.